Good evening. Thanks for watching. I'm Rolly Hoyt.
And I'm Marlisa Goldsmith. Lawmakers and UAMS officials are at odds over a vaccine mandate for all employees at UAMS. Some legislators say the hospital's new vaccine mandate goes against an Arkansas law that takes effect next year.
And THV 11's Ian Russell is live at UAMS this evening with more on the mandate. Ian?
Yeah, Rolly and Marlisa, here at UAMS, the majority of employees are already vaccinated against COVID-19, but now they need to be at 100%. Now, obviously, this vaccine mandate is supposed to help with that, and it could help save the hospital from losing millions of dollars in Medicare and Medicaid funding. But really, the big issue here, state lawmakers say this could be breaking what will soon be Arkansas law.
If I was UAMS, I'd be looking at every option too. I just don't think this was the best one.
Arkansas Senator Kim Hammer isn't mincing words. He says new rules from UAMS aren't right.
I think my first question is, did they violate the law? Because they are a state institution. By my opinion, they're a state institution.
Those new rules are ones we've seen introduced by other hospital systems in our area. Vaccines required for all employees. Dr. Cam Patterson, chancellor for UAMS, sent a letter to all employees Monday night. That was made public Tuesday. In that letter, Dr. Patterson says this is a difficult thing to do, but he goes on to say that if they don't, they'll lose Centers for Medicare and Medicaid Services funding, which totals more than $600 million a year for them. That's 60% of their total funding. Employees would be required to submit a medical or religious exemption form by November 23rd. After that, all employees must have their first shot by December 5th, with the second shot needing to happen by January 4th. The only problem, Senator Hammer says a new state law prevents UAMS from doing this.
It may be a matter that's going to be settled in the courts more than it would be, here at the Capitol.
Act 977, which goes into effect on January 1st, bans state entities like UAMS from having a vaccine mandate.
What we do for one, we have to do for everybody. That includes the application of the law. If the law says this is what you have to do, then that's what you've got to do.
And that has UAMS stuck between a rock and a hard place.
I think I would be remiss if I didn't look at it from their position that they are trying to figure out a way forward.
In his letter, Dr. Patterson says he doesn't want any employees to have to leave, but he realizes that may not be possible. And Senator Hammer says that's the most important piece here, losing employees who've worked through the pandemic.
The other thing we need to remember is that these institutions are also the ones that came to us and asked for a lot of money early on. They've gotten the money, and now they're putting their hardworking employees to the street. I think I would rather work for an employer that would stand up for me as an employee than yield to the federal government.
Now, I asked Senator Hammer if UAMS were to lose that $600 million in funding, remember 60% of its budget, then where would that money come from for the hospital? He told me that realistically, he doesn't think we'll actually get to that point. Live at UAMS, I'm Ian Russell, THV 11 News.
Thanks so much, Ian. Checking our COVID numbers for the day, hospitals like UAMS are in decent shape, but there are troubling signs ahead. The state reported exactly 300 patients being treated for COVID this afternoon. That's an increase over yesterday, but hospitals have been dealing with some of the smallest numbers of patients in months.
But the troubling trend is the new case count. Another day over the 800 mark. That's clearly turning the curve toward the wrong direction. New cases today means new hospital patients a few weeks from now.